Tell me about your symptoms before the surgery.
I was not able to move my neck. The neck was causing my arm not to move. I cut myself and didn't even know I cut myself.
So because you had so numbness,
it was
sensory
very,
deficit. Yeah.
I mean, I had no feeling whatsoever. And I barely could move my arm. And now,
move your arm down. Show me your arm.
I can go like this. And I am so excited. I was not able to do this before the surgery when I came in. Even with physical therapy, I could not move, do any of this. And my neck, I barely could move. Now, I can go like this, back and forth. Back and forth.
And this is a little counterintuitive because what we did for you, we did a 2-level fusion here in your neck. And many of my patients are asking me, so if you fuse these bones together, 50% of the motion in the neck is between the skull and the second vertebrae. We called it C2. And lots of turning from side to side happens here. Every other disc has 10% motion. So 50% the top 2 segment, 50% the bottom 5 discs. So meaning that if a surgery would take one single disc, a normal disc away, you would lose 10% motion. Normally in our life, we don't notice 10% or 20% motion kind of reduction at all.
Right.
But I think the point is that by the time people get to me and those discs need to come out, those discs has no motion left. So it is extremely rare that after this kind of surgery, anybody comes and says, they notice any different. As a matter of fact, almost everybody tells me that they notice that the motion is getting better because once the pain is gone, they can finally use this rest of the vertebra. Before that, every motion caused the material of the disc pushing on the nerve that comes through these holes. We call them foramen, and that give people symptoms like you described in going to arm, the numbness, even weakness. But once we get rid of the bad disc and make sure they grow together, finally people can use the rest. So I have done probably about a few thousand fusion. Not a single person ever have told me after the fusion that they can move their neck less. Almost everybody tells they can move it more because...
Oh, I can move it more.
Yeah.
Yes.
Yeah. Exactly the way you described. So you described it very well that now you can move your neck even more now.
Yes.
Now, how long after the surgery did it take for you to notice that the motion is getting better?
About a month and a half.
Month and a half. And that's a usual thing. Another thing as well is we talked about your incision.
Oh, it looks fantastic.
Yeah. And it's going to fade as well, will look better. Usually if in the incision in the neck, if they are horizontal.
Oh, it looks fantastic.
Yeah, we put them in a crease and they heal really well. Yeah, after usually 6 months to a year, they fade and they look like a crease in the neck. It's really hard to see.
I was not expecting this good of a result, to be honest. I thought maybe, okay, I will get just a pinch of relief. And I hit that depression, and now I'm back to wearing regular clothes. I'm feeling happy. I'm more like, I can do this.
Yeah.
I actually have more confidence in myself. And
I love the way you're describing it, because that is something neglected about us, that when people are in pain, it's not just pain. It turns their life upside down. Depression, many times we notice that if people cannot do things, they fall in depression, and that aggravates the pain and so on. So taking care of the pain is an important thing in a situation, and you described it very well. You're regaining your life.
I'm happy. I'm excited. I get to move my neck every way, and I'm not going to force it.
No, yeah.
But it's just happy that I got my life back right here.
And that nothing makes a surgeon happier than result like that. You made my day. Thank you so much. I appreciate that.